Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing health care to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Lina Huang. Lina is the clinical manager of the diabetes program at Washington Hospital Healthcare System.
Thank you for joining us for our Diabetes Matter presentation. I will be talking to you about diabetes medication. So the goal of my presentation is to review diabetes medication mechanism of action with you. And I'll be talking about oral diabetes medication as well as the newer classes of medication called incretin mimetics. We will not be discussing insulin. We will save that for a future date. And then we will also review names of oral and injectable diabetes medication as well as their side effects. So the objective of today's presentation is that by the end of my presentation, you should be able to describe at least one mechanism of action of diabetes medication and also state at least one oral medication and one incretin mimetic. And lastly, identify one side effects of oral diabetes medication. Before we start, let's review diabetes. What is diabetes and why diabetes happen? Diabetes, we know it is a long-lasting health condition, meaning it is chronic. It is something that will be with us. If you do have diabetes, it will be with you for a long time. There is no cure for diabetes just yet. And the reason we have diabetes is because our body either do not make enough insulin or make insulin, but somehow our body cannot utilize insulin as well as it should. So the way our body works, if you look at this graphic here, our body, our intestine and stomach turn food into sugar or glucose. So for the rest of my presentation, I will refer sugar as glucose. They're just interchangeable. They mean the same thing, but I will say glucose instead of sugar. So stomach and intestine will convert food into glucose, and that glucose will get into our blood vessel. So we go into our bloodstream here. Insulin, our pancreas produces insulin, and that insulin will also get into the bloodstream. And the insulin, what it'll do is it'll pull glucose into the cell. So insulin will act like a key, open the cell and let glucose in. And by doing that, the glucose that get into the cell can be utilized for energy. So we do need insulin for our body to produce energy. When we do not have insulin or we do not have enough insulin, what will happen is glucose cannot get into the cell. And as a result, we have high blood sugar or high blood glucose level in the blood. There are different types of diabetes. There are type 1, in which case our body does not make insulin or make very little insulin. Type 2, our body does not make enough insulin, or if it does make insulin, it cannot utilize insulin as well as it should. There's also a third type of diabetes. It's called gestational diabetes, basically diabetes that develops in pregnant women who have never had diabetes in the past. So who get diabetes? There are a lot of people, believe it or not, with diabetes. In America, there are more than 37 million Americans have diabetes, and that's pretty much 11% or 1 out of 10 people have diabetes. The majority of people have type 2 diabetes, so about 90 to 95% of the people with diabetes have type 2 diabetes, and about 5 to 10% have type 1 diabetes. Who's at risk? Pretty much almost everyone. If you have been diagnosed as having pre-diabetes previously, if you are overweight, if you are 45 years or older, if you have any relative with type 2 diabetes, If you are physically inactive, that also put you at risk for diabetes. If you've been diagnosed with gestational diabetes in the past, that also put you at risk for having diabetes later in life. Or if you belong to any of this ethnic group, that also put you at risk for diabetes. So diabetes affect almost everyone. Again, it's 1 out of 10 of population have diabetes. Unfortunately, diabetes can cause a lot of damage in our body. If we let the glucose uncontrolled, we have high glucose majority of the time, that high glucose can actually destroy a lot of our organ. It can destroy our brain, it can destroy our teeth, nerve damage, kidney damage, heart damage, and as well as eyes. Diabetes has been known to double the risk for heart disease, high blood pressure, and stroke. It is known as the leading cause of end-stage kidney disease, in which patient may have to end up in dialysis. It is a known leading cause of new cases of blindness. And overall, it is the 7th leading cause of death in the United States. So as far as the progression of type 2 diabetes, usually by the time you are diagnosed with diabetes, there have been at least 3 to 4 years prior to your diagnosis in which glucose level in your body already started to increase slowly. And that's because the pancreas function has started to decline 3 to 4 years prior to your actual diagnosis. And then by the time you are diagnosed, there have been some decline there. And then that decline tend to continue, and as 10 to 20 years down the line, we will continue to go down, and as a result your glucose level continue to go up as you have diabetes for a long time. So it does require continued management. It does require us to be cognizant and try to manage our lifestyle, and hopefully by doing that we can slow down the progression of the diabetes in your body. Before we review diabetes medication together, I do want to mention that diabetes management is not just about medication, right? Diabetes management include healthy eating, active living, monitoring, healthy coping, problem solving, and also the ABC of diabetes, which includes the A1C, the blood pressure, the cholesterol management. So all those need to happen in order for us to be successful in managing our diabetes, not just the medication. So I just want to mention that because many of you are also part of our clinic and seeing us in the patient diabetes education clinic. I do want to mention the difference between generic name versus brand name. Generic name is basically the chemical name of the active ingredient, while the brand name is the advertised name. So throughout my presentation, when we talk about diabetes medication, I will refer to this medication using the generic name. The brand name is just the name that a company give to their product. So even though the product may have the same chemical name, they may have a different brand name depending on which company is making the medication. So just for clarity, all the medication that are listed on my presentation will be under generic name. At the end of my presentation, I have a slide of medication that listed the generic name and brand name side by side. Let's talk about oral medication first. Oral medication work on different organs in our body. We work on pancreas, liver, muscle, gastrointestinal tract. This is where the intestine is, as well as the kidney. And each of this, when medication act on any of these organs, the purpose is to decrease the glucose level in the body, right? So let's take a look at one class of medication. There's two classes of medication actually that work on the pancreas. Pancreas produces insulin, like what we talked about earlier. And then the insulin is the one that pulls glucose into the cell to be utilized as energy, right? So these two classes, one class is called sulfonylurea, and the other one is megliteinide. These are the name of medication that belong to this sulfonylurea class. So for example, glimepiride, glipizide, glyburide, those are the three medication belong to sulfonylurea. Ripaglinide and aceclidine belong to megliteinide class of medication. This class of medication, the way it works is stimulate the pancreas to produce more insulin. So it makes the pancreas to produce more insulin, the insulin get into the blood vessel and then pull glucose into the cell to be utilized as energy. So this is how it works. The other class of medication is called biguanide or metformin. And the way it works is it keeps liver from releasing too much glucose. So our liver, it actually produces glucose as well as store extra glucose. It's a very useful organ. And the way this metformin works, it's preventing the liver to produce too much glucose. So basically just keep the glucose stored in the liver. And that's how it decreases the amount of glucose in the bloodstream. The other class is called thiazolidinedione. There's two drugs that belong to this class of medication. One is called rosiglitazone. The other one is called pioglitazone. So there's two medication under this one class. And the way the drug works, it makes muscle cell to be more sensitive to insulin. So because the muscle cell become more sensitive to insulin, it helps with the glucose uptake into the cell. So more glucose will go into the cell, and that's how it decreases the glucose level in the body. The other class is called SGLT2 inhibitors, and the name of the drug that belong to this class include canagliflozin, dapagliflozin, empagliflozin, and ertugliflozin. Just remember the word flow, flow. Anytime the drug has this flow, remember the flow in the kidney. The medication, diabetes medication that work on the kidney belong to this class called SGLT2 inhibitors. And the way it works, it make the excess glucose leave the body through urine. So the way our kidney work is that kidney filter blood and then also make urines. It will also actually reabsorb blood that get into the filtering process and then reabsorb this glucose back into the body. Now, the SGLT2 inhibitors, what it does, it actually interfere with that process. So instead of the glucose being reabsorbed back, the glucose doesn't get to be reabsorbed and then just basically leave the body through the urine. That's how the SGLT2 inhibitor works. The last class of medication here works on the gastrointestinal tract. The drug class is called alpha glucosidase inhibitor. There are two medications under this class, and they are called acarbose and miglytol. This class of medication, the way it works is it decreases glucose absorption from the gastrointestinal tract. So gastrointestinal tract processes food, and then as it processes food, it will absorb glucose into our system. But with this medication, it preventing the gastrointestinal to absorb glucose, and that's how this drug of medication decreases glucose level in our body. So this is an overview of how oral medication work to decrease glucose level. Let's take a look at each one of it and review their side effects. Okay, so let's go through sulfonylurea and meglitine, right? The way it works is stimulate pancreas to produce insulin. So then our body will actually have more insulin, right? And having more insulin, we'll be able to put more glucose into the cell. So the side effects of that is hypoglycemia. Just have a risk of having hypoglycemia, especially if you take this medication without eating, right? Because when you take this medication, it will stimulate the pancreas to produce insulin. And if you're not eating, then you don't have enough glucose in your body. And as a result, you will end up having hypoglycemia. So the recommendation is to take the medication 30 minutes before meal. And unfortunately, because it produces insulin will pull glucose into the cell to be utilized for energy. And if it's not used for energy, it will be stored. And as a result, that's, we can get weight gain from it. So one of the side effects for these two classes of medication is actually weight gain. So let's talk about this class of medication, which is biguanide, and the drug that belongs to this class is called metformin. This medication keeps liver from releasing too much glucose. The side effects that may occur with this medication, a lot of time it has something to do with abdominal. So metformin can cause abdominal discomfort, diarrhea. Sometimes it can also cause metallic taste. It just kind of make you feel that food doesn't taste good or as good as it used to be because of that metallic taste that, kind of lingering in the mouth. A lot of time you can decrease the risk for having a stomach upset. you can try to take the metformin with food to help decrease the stomach upset. Rarely, it can also cause what we call lactic acidosis. It doesn't happen very often. It's very rare incidences. But basically what happened is metformin somehow interfere with the way our body process energy. You're trying to, produce energy, and somehow it causes accumulation of a substance we call lactate. And when that's enough lactate accumulated, it causes our body to be more acidic than what it needs to be. And that's how it's called lactic acidosis. The symptom is usually you will have like a nausea, vomiting, maybe fatigue, muscle cramp, sometimes body ache, and maybe you also feel like you need to have to take a lot of fast and deep breathing. So if you do have this kind of symptom that are not caused by other reason, then I would urge you to contact your doctor or go to urgent care to have it looked at. The other side effects from metformin that's kind of unique is that if you take metformin for a long time, it can also lower your vitamin B12. So if you have taken metformin for a year or two, it's a good idea to check your vitamin B12 level and perhaps take supplement if needed. Now, the good news about metformin is that it is weight neutral, so it doesn't cause weight gain like the other two classes of medication that we just discussed. Let's take a look at this class of medication next, thiazolidinedione. Again, this one make muscle cell more sensitive to insulin, and that's how we can increase the glucose uptake into the muscle. The side effects is nausea, vomiting, stomach pain, and because it pulls glucose into the cell, right, it also associated with weight gain, unfortunately. One thing about this drug, rarely it can also cause liver problem. So if you already have a liver issue, like if you already have a liver problem to begin with, then it's a good idea to monitor your liver. If you're a pretty healthy individual, then probably it's not going to cause an issue, but it's a good thing to monitor if you have, for example, a dark urine or a pale stool, and also again, fatigue and tiredness. If you're experiencing any of that, then you do need to contact your doctor and have that be checked out, because that could be a sign of liver problem. The other thing about this drug that's unique is that it can also cause fluid accumulation. And because of that, it should be avoided in patients with heart failure, because obviously with the heart failure, you have tendency to accumulate fluid, right? Especially in your leg area. So this medication can make that worse. The other thing is this medication works pretty slow. It takes at least 2 to 12 weeks for it to become effective. Let's take a look at this class of medication, alpha glucosidase inhibitors, which decreases the glucose absorption. For this one, because it decreases the glucose absorption, again, a lot of the side effects have something to do with abdominal or stomach. And it quite bothersome for some patients because it does cause flatulence, diarrhea, abdominal discomfort. It is recommended to be taken with first bite of meal. And, we start lower dose, start slow to decrease the side effects. But the good news is it is weight neutral. Now, for SGLT2 inhibitors, the side effects in the study, it's been found that patient who's taking this medication somehow had a higher incidences of vaginal or urinary tract infection. A small percentage of patients in the study had more of this infection. I'm not sure why that is. It could be because there's a lot of sugar in the environment, and that sugar just basically being pushed into the urine, and then somehow, having a lot of sugary environment that increases the risk of bacteria to grow. The other side effects from SGLT2 inhibitors is dehydration, hypotension, which is low blood pressure, and the recommendation here is to monitor your kidney function. It's something that in the laboratory test, it could be something that's called eGFR, because the drug works by relying on the kidney to be functioning properly. One unique thing about this medication is that because the kidney pull all the sugar out into the urine, and the medication itself somehow help decrease insulin production in a way, because there's less sugar circulating, and in the body this medication somehow also decrease insulin production, and because insulin is less, you have less sugar being pulled into the cell. And because of that, it could be causing fat to be broken down. And when fat is being broken down to be utilized for energy, it can also have a byproduct that we call ketone. and ketone is acidic. So it's unique for this medication in that if you are fasting, because fasting is the same thing, we have less glucose get into our body. And because you have less glucose into the body, then, less energy, to be produced. And because of that, sometimes our body will resort to breaking down fat. And again, if that happened, potentially the byproduct of fat metabolism, it's production of ketone, which is more acidic. So the recommendation with this medication, SGLT2 inhibitors, is that if you do fast, you want to stop the medication 3 to 4 days prior. And this is something that you do need to discuss with your doctor, obviously, especially if you're going for a procedure or surgery and the surgeon told you you need to fast for a whole day, then you do need to kind of have a discussion either with the surgeon or with your primary doctor, your diabetes doctor, what to do with this medication. If you do need to hold it for 3 to 4 days, and the answer most likely will be almost 100% that you do need to hold the medication 3 to 4 days prior. Now, the good news about this medication is it is weight neutral. All right, let's move on to incretin drug classes. So there are two types of incretin that have been at least, investigated in terms of diabetes medication. The incretin is called GLP-1 and GIP. And for the purpose of our discussion, I would just call them as all incretin. There are two drug classes that work on this incretin pathway. One is called DPP-4 inhibitors, and the other one is called incretin mimetic. Mimetic means mimic or imitate. So basically, the drug mimic GLP-1 incretin, the way this incretin work in our body. How does this incretin work, and how does having incretin help with our diabetes management? So when we eat, having this intake of food into our body actually stimulate our gastrointestinal tract to release incretin. Unfortunately, incretin doesn't live very long. There is an enzyme called DPP-4 that actually degrades this incretin. So incretin only live about a few minutes in our body, and then after that, it got degraded by DPP-4, and only few incretin actually remain. So just think of DPP-4 like Pac-Man, kind of that digests a lot of this incretin. The way DPP-4 inhibitor works is that it stops DPP-4 enzyme. It kind of inhibit its action. And by blocking DPP-4 enzyme process, a lot of incretin are able to survive in our body, and we have a lot more incretin available to help us manage diabetes. So how does incretin work? Incretin work on multiple different organs. So for example, our stomach actually push food out to the intestine. We call that as gastric emptying. You're trying to empty the stomach, right? After we eat, push it to the intestine. So incretin kind of slow down the process of gastric emptying. That's how we feel full earlier, as well as potentially longer as well. So then we don't feel as hungry. The other thing is they also work on our brain to decrease appetite. It has a cardio protection as well as help the cardiac to function in such a way that we have a lot more cardiac output. So cardiac is basically our heart pumping, right? It pumps blood into our body, and the drug somehow help the heart to be able to pump more blood into our body. That's what we call by cardiac output. The other thing is this incretin also work on pancreas, and it increases the insulin secretion. And we know that insulin helps glucose to get into the cell, right? So increase insulin secretion as well as help make more of the beta cell in the pancreas. So the pancreas have a beta cell, and the beta cell is the one that actually produce insulin. So by having more of beta cell, the pancreas can produce more insulin. The other thing is it's also decrease the beta cell apoptosis. It's basically, our cell has a death and life cycle. This drug kind of help decrease the cell death of the beta cell. And therefore, we can have more of beta cell that survive and help with the insulin production. It decreases glucagon secretion. So pancreas produce insulin and glucagon. Insulin decrease glucose, glucagon increase glucose. So in this case, they suppress glucagon secretion, and that way, our body doesn't make a lot more it doesn't make more glucose into the body, and at the same time increase the insulin secretion, in which will pull glucose into the cell and decrease the amount of glucose in the bloodstream. So then having insulin, we know that it will help the muscle cell to uptake more glucose into the cell, then again help with the high blood glucose in the body. And then also having a high insulin secretion in the body will also basically tell the liver to decrease the glucose production, because insulin is working to pull glucose into the cell. It's just basically signaling them that we have enough glucose that need to be pulled into the cell. We do not need glucose to be released into the environment, kind of like counteracting what the insulin is trying to do. All right, so it has multiple action on a different organ. The difference here that I do want to point out is that for DPP-4 inhibitor, the incretin that we have is incretin that we already have in our body, what we call physiologic incretin, right? Because there's our own incretin that we just kind of like that the DPP-4 somehow help survive longer. So then, we can take the benefit of being around. On the other hand is the incretin mimetic. This is just basically a medication that work similarly as incretin, like trying to mimic or imitate the mechanism of action of incretin. So it's just trying to make that distinction, the difference between DPP-4 and incretin mimetic. The name of medication that belong to DPP-4 include sitagliptin, linagliptin, saxagliptin, and alogliptin. So I guess the N in here is stand for incretin, so gliptin. All of the medication that end with gliptin in the generic name belong to this class of DPP-4 inhibitor. And then as far as the incretin mimetic, the name of medication include exenatide, liraglutide, lixisenatide, dulaglutide, and semaglutide. The semaglutide is the one that we have heard in the news lately. The oral is called Rybelsus. The injectable is called Ozempic. And this is the one that can cause significant weight loss. The injection form of it, this is Ozempic, and that has been used quite a bit for weight loss. All right, so in terms of side effects, the DPP-4 side effects include upset stomach, cold symptoms, sore throat, headache. It can also cause pancreatitis. So that's something that you do want to watch for. The good news is it is weight neutral. The side effects of incretin mimetic include feeling full, loss of appetite. Sometimes it can also cause nausea and vomiting, and pancreatitis as well. The good news is it can cause weight loss, specifically the semaglutide, the one that I mentioned earlier. In animal study, it's been shown that the medication potentially associated with thyroid C-cell tumor. I have not heard any cases in human, but this is something that we do monitor closely. All right, so just want to display again to all of you guys the goal and objectives. So describe at least one mechanism of action of diabetes medication, as well as state at least one oral medication and one incretin mimetic, and identify one side effects of oral diabetes medication. So just want to state that once again for you guys to kind of like, review it in your mind of the discussion point that we just went through. Okay, so before we finish, I just want to go through some pearl on taking medication. So obviously, the advice here would be to take your medication as it says on the label. Make sure that you refill medicine before they run out. And one thing that's really important that I do want to stress out here is that keep your clinical team informed, right? You can take all your medication with you with every single visit. If that's not convenient, you can keep a list of your medication and share that list with your clinical team. And if it's too difficult to make a list, what you can do, just use your phone and take a photo, a snapshot photo of each of the label of your medication, and you can share that with your clinical team during your visit, and make sure that you include over-the-counter medication, any vitamin or any supplement that you take as well in your list of medication, because any of this over-the-counter vitamin or supplement potentially may interact with your diabetes medication. So make sure that you bring all of them or take a photo of all of them. And in terms of hypoglycemia, we talked about this in the past. On the right-hand side here, there are signs and symptoms of hypoglycemia, which include anxiety, weakness, numbness, fatigue, dizziness, headache. Maybe you feel like your heart is beating a little bit too fast. Just want to remind everyone to use your either CGM or glucometer. If it's less than 70, go ahead and treat using a 15 gram of carbohydrate. I'll list the amount of 15 gram carbohydrate in terms of juices or soft drink that you potentially have at home. And then, basically you do want to give yourself 15 gram of carbohydrate and then wait 15 minutes and then recheck again. And you may repeat it one more time if your blood glucose is still low. Obviously, if your symptom is more severe and you need more than 2 times of the medication, you may consider calling your doctor or go to urgent care to get more help. As promised, this is the list of medication from drug class, generic name, and brand name that we discussed earlier. The generic name, for example, glimepiride, and the brand name here is Amaryl. So this will be your list that you can use for your review.